Jumping in a minute, I think. And hello, everybody. We are now live. We will have some people joining us in the webinar in a moment. If you're watching this after the actual event on our YouTube channel, you're welcome to contact the office. My contact information is right on this slide, and any member of the HCMA team will be here to assist you. So thank you for joining us on HCM Awareness Day. Hereafter known as Lisa's first day of not having COVID in over a week. So we will talk to you a little bit in just a second. We're going to be live in about 2 minutes. So, what's the weather like today in Indiana?
It's sunny. It looks like spring is here. It's a little cold, but it has been sunny. So I'm happy about this change. Didn't feel like we had winter this year.
No, we didn't have it either. And I have a rainstorm in New Jersey today, and it's like in the mid 60s. So it's very
Mm.
confusing to be in New Jersey right
Yes, it has been very confusing. Like we had like winter storm and spring in 3 days.
now. I don't know that we're ever going to get used to these new weather cycles.
Yes, yeah, it definitely has been crazy.
But no matter what the weather cycle is, we always want spring to show up.
Yes,
We're
yeah.
always done with winter.
Yes. Yeah. 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 No complaints. As long as there is some snow during Christmas Day, we are good.
We haven't gotten snow in December in a while.
Ah.
So we had one decent snowstorm. And of course, it was the day that I had to leave and go to Washington, D.C. We had 11 and a half inches of snow. So
Wow.
that was fun. That was
Oh
fun,
my
but we
God.
somehow made it
Oh my
happen.
God. Wow.
Okay. So we are going to get started now. So thank you all for joining us on our 6th legislative briefing of the day. It's been a very busy HCM Awareness Day already, and we are looking forward to sharing with you how we can help improve the heart health of those in Indiana. So today you're going to learn a little bit about the Hypertrophic Cardiomyopathy Association. You're going to hear a little bit about what HCM is. You're going to see your state report card. You're going to hear some stories. And then we're going to tell you what we're going to need from the legislative body to help improve heart health history examinations in the state, and frankly, how we can work together to keep families whole. The HCMA is a 501c3 nonprofit organization founded in 1996. We have been here to support patients, families, and the medical community all this time, providing lots of different services that you can learn about on our website, including our Center of Excellence programming. And it is our goal to ensure that families stay whole and that we are here to advocate that they can get access to the care that they need for their very wonky hearts. Okay. So we have Dr. Rao here, who is joining us from the University of Indiana, and hopefully in the not too distant future will become part of our HCMA recognized network of care providers. And we're going to ask her to tell you a little bit about what this disease, hypertrophic cardiomyopathy, is. Doctor, off to you.
Thank you, Lisa, and good afternoon to everybody, and thank you for this opportunity. So I'm going to talk a little bit about hypertrophic cardiomyopathy. It's a genetic disease, inherited disease, and it affects the heart muscle. Hypertrophy meaning thickening of the muscle. And as you can see here in this picture, on the top right is a normal heart. And in a normal heart, the heart muscle is about a centimeter thick. But on the bottom right, you can see a hypertrophic cardiomyopathy heart. As you can see here, there is thickening of the heart muscle. So the thickening can vary. Normal is 1 centimeter. We see 1.5, 2 centimeter, and in extreme cases, 3 centimeter or more. When the muscle thickens, as you can see here, the cavity is small and the heart cannot hold enough blood. It just not thickening. The heart muscle also becomes stiff so that it cannot relax and cannot do the function that a normal heart can do. What are the statistics like? How common is hypertrophic cardiomyopathy? It's actually one of the most common inherited heart disease. About 1 in 250 patients are affected by this condition. That leaves us an estimated 1.3 million people out there with this condition. However, there's only an estimated 150,000 patients who currently carry this diagnosis. So that definitely leaves us a big void and a need for more awareness of this disease. Risk of sudden death, especially in young people, is common, and Lisa will elaborate on this, with some patient examples. But that's one of the dreaded complication of this disease, and it can also cause other symptoms, which I will explain in the next slide. So, what can happen? Why is this important? Why there is a need to raise awareness? There are different things that can happen. As you can see here, one of the most dreaded complication is sudden cardiac death. These are young patients who are talking to you who can drop dead right in front of your eyes. Or you have heard stories where somebody went to bed and didn't wake up the next day. So that is what is sudden cardiac death. And usually it happens in young people. However, the good news is that this is preventable. If we do the timely diagnosis, and there are certain risk factors, and we can do something called as a implantable cardioverter defibrillator, or in simple terms, ICD. It's a fancy device that goes in below the clavicle or the collarbone, and the leads go into the heart. And this device detects the heart going out of rhythm and delivers that life-saving shock. And we have so many success stories with timely diagnosis that this device has saved lives. What else can happen? As I alluded to before, that the heart cavity is small, the muscle is stiff, so these patients develop heart failure symptoms. So, what are those symptoms? Shortness of breath, chest pain, cannot do the activities that normal people can do. And these could be simple activities. Like some of my patients say that they cannot chase their 2-year-old, 4-year-old. They cannot climb a flight of stairs. They cannot even walk a block. So these could be very disabling, especially for young patients, and they cannot carry on with their day to day activities and life limiting. But again, the good news is with correct diagnosis, there are a lot of medicines available, especially newer medicines that could be life changing. And I have seen it when I treat my patients. They get their life back, they can climb that flight of stairs, they can walk, and they can get back to work or whatever else they want to do. And in some patients, they may have to undergo surgery, especially, the heart muscle becomes thick in certain areas of the heart. So the surgeon will go in and resect or take out that muscle that is big or thick and actually cure them for their life. And in extreme cases, when drugs or the surgery is not helpful, these patients go on for heart transplant. And again, we have few patients who have undergone transplant and lead a normal life. Another complication is atrial fibrillation, where the upper chambers of the heart beat erratically or irregular heartbeat, which again cause symptoms of shortness of breath. And one of the worst complications is stroke. It's not uncommon that patients present with stroke, and then we realize that, oh, these patients have atrial fibrillation because of hypertrophic cardiomyopathy. Again, this can be prevented, life can be saved if we appropriately diagnose them in a timely manner, and simply putting them on blood thinners can save life and prevent stroke. So in summary, this is a condition that is genetic, like about 50% of the chances of transmitting it to their children, and it is common, but it is still, there are many people who are not diagnosed, and it can be disabling with sudden cardiac death, heart failure, stroke, but we can save life and disability by timely intervention and raising awareness. Thank you, Lisa.
Thank you so much for that excellent explanation on the disease and the pathways. So, I'm going to talk now a little bit about our state report card. Did you know you got a report card there, Indiana? So, the HCMA has put together a comprehensive report card on all of the things that states can do to prepare for and ensure that people do well post cardiac arrest. So, AED placement in the community, raising awareness about HCM with HCM Awareness Day resolutions, which you have, which we'll talk about in a minute. And then the elements of the Healthy Cardiac Monitoring Act, which we'll talk about a bit more in detail shortly. And why these things are important, I'm going to go through a couple of cases with you and explain why we're doing what we're doing and why we've taken the path that we have. Additionally, we don't want to just think about the cardiac arrest preparedness or looking for HCM or other forms of genetic heart disease in the young. We also want to make sure that once somebody is diagnosed, they have access to the appropriate therapies that their physician feels are appropriate for them. So we want to make sure that there are no copay accumulators, schemes in place from insurance companies. So we need some legislative assistance there to make sure that patients can afford their medication. We need to make sure step therapy laws are logical and do not add a burden to the patient or the healthcare provider in jumping through hoops year after year to make sure patients aren't having to go back and revisit step therapies. We need safe medical delivery. As our temperatures are rising, which we kind of were discussing in our preamble today, delivery trucks are hotter and your medications are sitting in these hot trucks for longer periods of time. We need to start thinking about how we're going to make sure medicines are transported safely to patients. And we also need to make sure that there is not any non-medical switching, meaning that your insurance provider is deciding which medicines to prescribe for you and not your chosen healthcare provider. We want to put the care of the patient into the responsibility of the physician and the patient, making shared decision making and making sure that they have access to the medications that they need. So we have ways of looking at those laws. And right now, Indiana, thank you so much for recognizing HCM Awareness Day with a resolution this year. But your score on your report card this year is a C. We need to do more work to have AEDs available in schools and public buildings. We need to make sure that we have copay accumulator laws and that the elements of the Healthy Cardiac Monitoring Act, which I will discuss in more detail in a second, are in place for your state. So let's take a look at a story. This is a beautiful young lady named Jillian Blair. Jillian's no longer with us. She passed away in April of 22. And her mother's going to tell you the story of delayed a diagnosis that had timing been a little bit differently, Jillian might be with us today. Here is her mom, Amy Blair. Just hit the key and it'll take to the next slide.
Thank you. Okay. So on February 15th, 2022, which is 2 years exactly today, my 17-year-old daughter, Jillian, and I, we walked into our family physician's office for her well child check. And while we were there, the doctor put her stethoscope onto Jill's chest and she turned to me and she said, "When did Jill get this heart murmur?" And so that appointment led to us going to see a pediatric cardiologist in Des Moines. And from there, we had the diagnosis of hypertrophic cardiomyopathy. And those words, severe and obstructed, they were still lingering in the air when we were waking up in Omaha, Nebraska to see specialists 1 week later. She went ahead and did a battering of tests. And then on Thursday, April 21st, 2022, the doctors were able to come back and give us our very last test result, which was her genetic test that she was positive for the MYBPC3 gene, which connects her to HCM. She came home from school that day. We went ahead and made an arrangement to see them on Monday and kind of get a plan of action. She came home an hour and a half later after I hung up the phone with the doctor, and I told her what they discovered. And she said, "Okay, that's about what I expected." She ran up the stairs where she had a sudden cardiac arrest. I was able to get up to the stairs within a minute or two. There was a lady who lived across the street who actually sold AEDs, so I had an AED on her within 2 minutes. But unfortunately, our efforts, the efforts of the EMS and the hospital staff were not successful, and we lost Jillian that day. So Jill was a very funny and outgoing girl. She loved music. She loved Harry Styles. He was her favorite. She loved art. She was really, really bad in algebra. And she wanted to be a designer one day. After Jill's death, I started it was like an explosion went off, and I started connecting dots within my family. And I talked to lots of families on my members of my paternal side, and I found out that we had a lot of similar heart problems. With the help of Omaha, we were able to get all of my siblings, all of my cousins tested. And when we discovered that I had HCM, half my siblings had HCM, 25% of my cousins had HCM. And from then, we now have many of us have ICDs and have had myectomies. We have also lost them. My brother has died in a surgery that was a valve surgery for an enlarged heart. My nephew has had 2 myectomies. My sister had a sudden cardiac arrest 5 months after my daughter died. And I just say that she died of a broken heart, since we're not ever sure exactly what it was. But my family is actually lucky because of Jillian, because she was our call to action. Because of her, my family has the power of knowledge to be able to fight against an invisible gene. But not all families are that lucky. But there is hope for them. Had there been big questions that were in place when I took all of my girls to their well child checks that we were asked each time, so that in 2010, when my nephew had his first myectomy, or in 2015, when my brother had died on the surgical table from his HCM, maybe some of the doctors could have put it together that we needed to do a little bit more investigation. Or when my 91-year-old father, who had HCM, and that's how he went down too, he had a sudden cardiac arrest. But if he had gone into his Medicare first visit and was able to tell them that he had 7 siblings who died, all of cardiac arrests, maybe that would have been a trigger to have them look at us a little bit easier. If we had gotten the treatment earlier, I'm hoping, it would have been hopeful that she could have got diagnosed earlier, which would have led earlier treatment, and maybe would have saved Jill's life. And lastly, I am a nurse in Iowa, and I work at a family practice clinic. It would take me 5 extra seconds of my day to ask these questions to a patient, and that would help save thousands of dollars, millions of dollars, and keep thousands of family intact and whole. I wish it wasn't me standing here, and I wish it wasn't my daughter. I wish it wasn't my family. And I wish it wasn't that I know the heartbreak that people go through. I wake up every day and I live a nightmare. But it is me, and it is my family, and it's my wish and my hope. And I wouldn't be standing here, and none of you would be hearing my voice if it wasn't for the life of a girl named Jillian Blair, and she had HCM.
There's no way, even though I've heard that story many times and I've watched it 5 times today again, that it doesn't just jar you that this woman has lost her child in such a tragic way, when there was more that could have been done to help put the pieces. Oh, this keeps happening to me. There's something on that slide. If we could have put the pieces of the puzzle together and made sure that when the nephew had his surgery, or when the uncle had his surgery, or when AFib showed up in a family member, and that when a family member had genetic testing, that they put the pieces of the puzzle together, we could have saved Jillian. And that's why we want every state to enact the Healthy Cardiac Monitoring Act, so that we are asking family heart health history questions of our children. You shouldn't be seeing a collage of pictures of this beautiful artistic young lady. You should be seeing what world she would have created with her artistic ability and her vision of the world. But we'll never see that because Jillian is gone. There's another story I wish to tell you, and it's about a young man named Derek Armstead. His story is similar, but different. His mom passed away about 30 years ago. Actually, it was like 27 years ago, from something with her heart, but nobody was ever really sure what was going on. And Derek was just a child, a very small child, when his mother passed away. So he didn't have the knowledge of the family heart health history because it was kind of lost in the family, and they didn't talk much about mom because she had been gone for most of his life. He had an older sister. She didn't know much about mom's health. So in August of 2020, when we're all still in our COVID lockdown misery, Derek was playing with his nephew and niece, and he had an event that left him unconscious. They called the ambulance. They got him to the emergency room. They did everything they were supposed to do as a family. And he was told that it looks like maybe you had a seizure, or maybe you have epilepsy, or something's going on. But nobody ever asked him about his family heart health history. Nobody ever looked at his heart in the emergency room after a 29-year-old looking healthy Black man in Virginia showed up in an emergency room. So they sent him home and told him to go see a neurologist. 5 days later, he was carrying his son up the stairs in his car seat, got to the top of the stairs, and collapsed and had a cardiac arrest. And he was not resuscitated this time. And he was found to have HCM on autopsy. Had somebody thought to ask this man in an emergency room, is there a family history of heart disease? What's going on with your parents or siblings? Maybe somebody would have gotten there in time and Derek would be here to be a father to his child. But instead, his fiance is left to raise his child alone with a dad that can't be there anymore because he's gone. We have to do better. HCM affects all ethnicities equally, and that is why the HCMA has taken on the project of the All Hearts Collaborative, which we hope to roll out in the coming months to ensure that all families have an opportunity to talk about their family heart health history with their chosen healthcare provider, and that we can save all hearts and make sure families stay whole, regardless of your ethnicity, your gender, or your geographic location. We have to do better. We can do better. We're smart enough. Let's get behind this. So, what can we all do together? The Healthy Cardiac Monitoring Act will add questions to the well child examination that will help identify family history of heart disease and symptoms in the children. It will also provide professional development tools for healthcare providers for an online training portal so that they will be able to identify the diseases that maybe they didn't really learn a lot about in med school. There's a lot of different genetic heart diseases that we're learning about, and our knowledge continues to evolve. And if we understand them better, we can take appropriate action. We want to improve the pre-participation screening physical for student athletes, ensuring that there's only one form per state, that you don't have each little municipality creating their own rule book. We need some systematic improvements there. And we want to improve the healthcare provider's ability to identify those with genetic heart muscle disorders that could result in catastrophic outcomes like sudden cardiac arrest. The Hill briefing that you saw a segment from was our first Hill briefing. It took place 2 weeks ago. And we are seeking on the federal level to just add these same questions to the Welcome to Medicare examination or visit. If we're asking on the grandparent side, the 65 and older group, in their Welcome to Medicare, and we're looking at the well child exam, we're going to be able to find we're going to have bookends on these families. We're going to see the kids, we're going to see the grandparents. These are genetic diseases. They impact families throughout the continuum of time. So we need the help of the state legislative bodies to make this a reality. So what is the population? You've got about 6.7 million people in the state of Indiana. 1.5 million are under the age of 18. And what are we looking at for these diagnoses? For HCM, ARVC, dilated cardiomyopathy, and the most common genetic forms of heart disease in the young, you're on the low end, 73,000 individuals in the state of Indiana, with a high end of 200,000 individuals in the state of Indiana who have diagnosable diseases. And if we can get to them and give them the screening that they need and get the therapies in place, these are people who are at risk of sudden cardiac arrest. And for those who aren't aware, every day in America, about 1,000 people die from sudden cardiac arrest from all causes. If we're able to find those who are at highest risk and treat them appropriately, they won't die on those days. They might get a shock from their ICD and have to call their doctor and say, hey, something just happened, but we'll have the ability to keep these families whole. So this is some footage from, or some snapshots from, our day on the Hill. And I bring to your attention the picture here in the middle. This is Marcia. Marcia is 81 3/4. She has had open heart surgery for her HCM. She has had other procedures for her HCM, and she is currently a QVC model. So if you're flipping through QVC and you see some beautiful old lady who is out there living her life, almost 82 years old, that's Marcia, and she has HCM. And she's forming a heart with Jared Butler, who's currently playing for the NBA with hypertrophic cardiomyopathy. So you can live a lot of different kinds of lifestyles with HCM. You can be any color, you can be any age. We all share our heart disease, And that's why these individuals came to Capitol Hill to share their story and show how they're living and thriving with HCM. And we want to make sure other people can do the same. So a big shout out and a big thank you to the state of Indiana for recognizing HCM Awareness Day with a resolution. We really appreciate that acknowledgement, and it gives us an opportunity to shine a light on HCM and start talking about what we can do to make the lives of those with genetic heart disease a little bit easier. So that's one step. But we need to get these laws moving. We need to get some bill numbers. We need to get in front of some committees. We need to start talking about this on a much more global level within your state legislature. So if you would like to talk to the HCMA about how you can become a champion, please scan this code and you can go to our calendar and set an appointment that works for you. And we'd be really happy to speak to you about how we can help you bring this to the forefront in Indiana. Our state legislative champion for Indiana is Bill Rossi. He is a pretty well-known businessman in the state of Indiana who is really passionate about HCM. He's also a member of our board of directors and an HCM patient himself. So we have boots on the ground. We have some other individuals. Joey Graham is our podcast editor. He also lives in Indiana, and the two of them are a bit of a force to be reckoned with. So thank you to our Indiana guys. And thank you to all of our board of directors, our staff, our volunteers, our partners, and our sponsors who are helping make HCM more understandable. And we're out there trying to save and improve lives. And I am a recipient of all of this good work. I didn't mention it earlier, but one of the pathways of hypertrophic cardiomyopathy is to go to transplant. And 7 years ago this month, I received a life-saving transplant, and my donor's name is Brandy. And I'm only here today because of scientific discovery, clinical trials, and a young lady named Brandy who passed away, and her family gave her organs so that I could be here with you today to try to change the future for other people with HCM. Thank you so much for your time and attention today. If there are any questions, we'll be happy to take them now. Dr. Rao, what do you think about the initiatives and what are we doing in Indiana and how can we make it better?
Lisa, first of all, thank you for such a wonderful presentation. And I think it is very relevant because these are lives that we can save. And these are young people and it hits them all of a sudden. And I think I totally agree that there is a big need to raise awareness. And also there's a big need because these lives can be saved by timely intervention, like AED, I mean, it's not uncommon. Like I go to my son's basketball game and I'm like, now I'm very cognizant. I'm like, where is the AED? And I have to search. To be very honest, I have to search. And it is locked away sometimes, not easily accessible. And as all of us know, it's like muscle, like it's minutes, every second counts. So I think, I am very much in support of raising awareness and also, the simple things like asking extra questions in the, routine medical exam or making AED available easily. I think these are simple, but I think can make a huge difference. And as a provider, I'm like, oh my God. I mean, I do see a good amount of patients who got appropriately diagnosed. But on the other hand, as you said, there is 1,000 patients dying every day with sudden cardiac death. And there's a lot of work to be done. And these are simple tools that can save lives.
Well, we hope that the people of Indiana get behind these efforts. There'll be lots of ways for you all to get involved in the year ahead as we start to move some of these legislative initiatives. We know that it is a politically interesting year in 2024 here in America, but we know that there are some common sense bipartisan approaches that we can take to help keep families whole. And we're looking for partnership from all of our stakeholders to help make these a reality. So thank you all so much for joining us. This was our 6th legislative briefing of HCM Awareness Day. And we're going to take a little bit of a break and come back to you live at 6:30 this evening, East Coast time, for a 3-hour event to talk about all things HCM and what the HCMA is doing in lots of different spaces. So come join us. You'll see some clips from our Hill visit. And we hope that you all are having a great HCM Awareness Day. And thank you for participating.